Ladies and gentlemen, welcome to the main event.
Today, we're diving into the potential impacts of the September 2025 drug price negotiations under the Inflation Reduction Act. It's a hot topic in healthcare and pharma right now.
Absolutely. The negotiations could reshape how drugs are priced for Medicare. There are hopes for savings, but also concern about unintended consequences.
Right, especially around access and innovation. Some analysts worry that lower prices might mean fewer incentives for developing new drugs.
On the flip side, lower prices could make medications more affordable for seniors. That's a huge win for patients struggling with high out-of-pocket costs.
True. But what about the risk that manufacturers might pull certain drugs from the Medicare market if negotiations cut prices too much?
That's a real possibility. If revenue drops, it could make some products less viable. There's tension between affordability and availability.
It's like a seesaw. Push too hard on price and the balance tips. But if you don't push at all, costs keep rising unchecked.
Exactly. The article points out the need for careful implementation. It's not just about numbers. Policies must consider downstream effects.
One interesting point is how negotiations could affect clinical trials. If future revenues are uncertain, companies might invest less in risky research.
But some argue that the big players have enough resources to absorb these changes. Smaller biotech firms, though, might feel the pinch more acutely.
That's a great distinction. It's not one size fits all. The ripple effects could be different for established companies versus startups.
Another aspect is transparency. The negotiation process will likely demand more data sharing from manufacturers, which could improve accountability.
Although too much transparency might expose proprietary information, making companies uneasy. It's a classic dilemma.
And then there's the legal angle. The article mentions possible litigation as companies challenge the scope or outcomes of negotiations.
Legal battles could delay implementation, adding another layer of uncertainty for patients and providers.
Do you think these negotiations might inspire other payers, like commercial insurers, to seek similar price reductions?
That's likely. Once Medicare sets new benchmarks, private insurers often follow suit. The whole market could shift.
Interesting. But could this also mean manufacturers try to recoup losses by raising prices elsewhere, or cutting back on discounts?
It's possible. The global marketplace is always adjusting. Sometimes it feels like squeezing a balloon. Pressure in one area pops up somewhere else.
The article also talks about stakeholder engagement. Getting feedback from patient groups and providers is crucial to avoid negative fallout.
Yes, because those on the front lines see impacts most directly. Their input can help fine-tune the negotiation process.
There's also mention of exceptions and exclusions. Some drugs, like orphan drugs, might be carved out to protect incentives for rare disease treatments.
That's smart, but it raises questions about fairness. Where do you draw the line, and who decides what gets excluded?
Policymakers have a tough job balancing cost containment with access and innovation. No easy answers here.
Do you think we'll see more collaboration between public and private sectors to address these challenges?
I hope so. Sometimes competition drives progress, but collaboration can help smooth rough edges and prevent unintended harm.
Ultimately, the success of these negotiations depends on flexibility and ongoing dialogue. It can't be a one-and-done process.
Agreed. Monitoring outcomes, adjusting policies, and keeping communication open will be key to minimizing negative impacts.
The article ends on a cautionary note, reminding us that changes in drug pricing affect real people, not just balance sheets.
That's a great point. At the end of the day, it's all about making healthcare better and more equitable for everyone.
So, as September 2025 approaches, staying informed and engaged is crucial. There's a lot at stake for patients, providers, and the pharma industry.
Absolutely. And maybe next time, we'll see some innovative solutions emerge from this challenge. Let's keep watching and keep the conversation going.
Thanks for joining us. Until then, think about how policy decisions ripple through every part of healthcare.
And ask yourself, how can we balance affordability, access, and innovation in the future? See you next time.
A special thank you to MarketUS.com for furnishing us this information.
Here's a question. How do we contact them?
Good question. You can reach them at MarketUS.com or call them at 954-636-3232.
Before we go, this deep dive was created by the MarketUS.com team.
Let us know your thoughts in the comments below.
Good point. It's right below the subscribe link.
Thanks for watching. I'm Nancy, your AI avatar. If you like this podcast, you can get one for yourself based on a website, YouTube video, or any source. Contact me to get a customized quote for your content. See you soon.